Is that agreed?
Thanks, Chair. The Dáil debate is on whether or not we should sign off essentially on an additional €500 million for the health budget. And I'm going to come to that and the lack of analysis being provided to the Dáil on it. But while we're talking about health services that urgently need more funding, Chair, I want to raise one matter in particular, which is Cappagh, the National Orthopaedic Hospital. A constituent of mine contacted me in the last few weeks. She needs a hip replacement. She's in severe pain. Her condition is deteriorating. She's on her way to being in a wheelchair. I've had this confirmed by her surgeon. And she was told she'd have to wait 15 months. So I looked further into what's going on at Cappagh. And what I discovered is really very disturbing. Here's the situation right now in Ireland. For the Greater Dublin area, if you need orthopaedic surgery, or indeed for the whole country if you need complex orthopaedic surgery, because that's what Cappagh does. Right now in Ireland, if you go to your GP and the GP thinks you need orthopaedic surgery, it'll take you 15 months to get to see the consultant. When you see the consultant, it'll take another 15 months to get into an operating theatre. So right now in Ireland, it takes 2.5 years to get from your GP to the operating theatre. Now in the UK it takes 4 months, and in New Zealand it takes 3 months. Now I've spoken to surgeons who are dealing with this, and to say that they are demoralised and frustrated and angry would be a gross under-exaggeration. Anyone who goes to the GP who needs orthopaedic work, be it a hip or a knee, typically is already in a serious amount of pain. That pain over the 2.5 years that they're waiting for surgery escalates. The condition deteriorates, the complexity of the operation and the cost of the operation and the recovery time of the operation all move in the wrong direction, as indeed do the clinical outcomes of the operation. So here's what's going on in Cappagh. Here's why this is happening. Here's why people in Ireland are waiting 2.5 years for a hip. Oh, and by the way, if you need the other hip done or you need the other knee done, here's what happens. After your 2.5-year wait, they put you back to the start of the list for the other hip or the other knee. So that's what's going on now compared to just 12 weeks in New Zealand, 16 weeks across the water in the UK. So here's what happened. In 2014, Cappagh had a serious cut in funding from the government. That meant that they had to scale back the number of procedures they could do. They did 700 less procedures that year. They let staff go, they scaled down. In 2015, the situation had become so bad that the government increased their funding. So last year, they started to scale up again. But of course, they had to hire agency staff because they didn't want to have to fire people again. So they started incurring higher costs. At the start of this year, the HSE couldn't tell them how much money they were going to have for the year. So for the first 3 months, they operated on an understanding that they'd have the same budget as they had last year. They found out after Q1 that actually they were going to get another funding cut. So now they have to let staff go again, they have to scale back. The situation in Cappagh right now is as follows. There are 6 operating theatres in the hospital. Only 3 of them are being used. Typically, an orthopaedic surgeon can do 5 procedures in a given day in an operating theatre. They have been instructed to stop after 3 procedures. So here's what's happening. The state is paying all of the fixed costs of the hospital. They're paying for all 6 operating theatres. We're paying for the wards. We're paying for the beds that aren't being used. We're paying for the theatre staff. We're paying for the surgeons. So we're paying all of the fixed costs. What the hospital no longer has money for is the implants. Now, an implant for an operation will cost typically somewhere between €1,500 and €3,000. For a very complex operation, it might cost up to €6,000, and obviously it goes up. The patients themselves, I said, well, if it was a relative of mine, I'd borrow the money and go and buy the implant on eBay and bring it in. Can they do that? And the answer is no, they're not allowed to do that. So I asked the surgeons, well, what are you doing? After you do your 3 procedures, what are you doing? They said, well, we're going home. Or we're going to private practice where we can actually treat people. So, Minister, can I ask one of you or both of you, I noticed Minister Harris obviously had to go, to raise as a matter of urgency the fact that the National Orthopaedic Hospital in Ireland hasn't got the money, because of government cuts, for the implants needed for people who are waiting 2.5 years for orthopaedic surgery. But actually it's worse, because as I found out, the 15-month target from meeting a consultant to getting into the operating theatre, that's actually a HSE target. Cappagh is now going to miss those targets. The HSE is therefore going to fine Cappagh for missing those targets. Cappagh is going to have less money for implants, the waiting lists are going to get longer, and the HSE is going to fine them again. So that is happening right now in our National Orthopaedic Hospital. So if we're having a conversation about a budget of 13.7 billion and an additional spend this year of 500 million euro, Ministers, can I ask you to please, as a matter of urgency, engage with Cappagh Hospital? They need about 5 or 6 million for the rest of the year. The other thing that they need, and I cannot understand why it doesn't happen, is multi-annual funding. Imagine a hospital running through the first 3 months of the year not knowing how much funding they were going to have for the year. I mean, other organisations just don't operate like that. They need funding for this year. They need multi-annual funding. They need more ambitious targets. It's not acceptable that the HSE target for orthopaedics is 15 months. That needs to be brought down. The other thing that's not happening is there's no load balancing across the hospital. So the waiting list, it turns out, in Limerick are much lower than in Dublin. But there's no national patient database. So there's no coordinating function saying, you know what, right now you've got to wait 15 months in Dublin. Would you be willing to go to Limerick and go on a list there and wait 6 months? There's no load balancing of that going on at all. So, Minister, in the Chamber, I'll send you the notes. Would you please, please, please take a look at providing a low number of millions to the National Orthopaedic Hospital, and I'm more than happy to send you on all of the details. But what's happening in Cappagh and the mismanagement by the healthcare system of the funding for the hospital and the results for patients and for the medical staff is symptomatic of a HSE which clearly doesn't know how to run budgets. I mean, think about what's happening right now. The government has come in and is asking the Dáil to sanction an additional 500 million euro. Now, to put that in perspective, that's more than half of the total fiscal space we're going to be debating in October for the entire budget for next year. So there's an extra £500 million, over half the entire budgetary space for next year, which the government is looking for. And Minister, I apologise if the analysis is available. I've tried, we've contacted your office, we've looked on the Department Health site. I can't find any breakdown of this 500 million. Minister, I've read through your speech and I found allocations for explanations for 40 million here, 50 million there, 15 million in other places. But this is the revised book of estimates. It gives the budget for this year, the revised budget of 13.69 billion, but nowhere is it explained where the extra 500 million has come from. There's bits of it in the speech, but I cannot find a table saying here's how the 500 million breaks down. It's 200 million for additional services, it's 300 million for overruns. The 200 million for additional services is going to the following places based on the following cost-benefit analysis. Like, the Dáil voting through an extra €500 million is a massive undertaking. But we're not being provided, and apologies if we are and I just can't find it, but I can't find the kind of analysis anyone would expect to see if being asked to sign a cheque for €500 million of unexpected money. Because that's what this debate is about. Is the Dáil willing to sign a cheque for the HSE for an additional €500 million? Surely, Minister, that's something that now that the committees are being formed, surely that's something that should go back to the Health Committee or to the Finance Committee or to the new Budgetary Committee to explain why it's 500 million, what the overruns are. And I'll finish on this, Minister. I notice you mentioned in your speech the new accountability framework that the HSE is putting together. It's very welcome to see an accountability framework coming together. In my pre-politics world, if people came in and said, actually, sorry, we've overspent by €500 million, there'd be serious accountability. And I'm not talking about you, Minister, you're new in the job. I'm talking about the HSE. Has anyone been fired? Has anyone been demoted? Someone, somewhere, has overspent by hundreds of millions of euro. So is the accountability framework actually going to hold anyone to account for overspending by hundreds of millions of euro. I'll leave it at that. Thank you, Chair.